The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Welcome to Wonderfully Made. In today's segment of Wonderfully Made, we will look into the role of preventive medicine in diabetes. I am Dr. Meshach Samuel. I currently serve as a family practitioner, and I enjoy doing what I do in the field of primary care. I love preventive medicine, and in our study today, we will try to apply the principles of preventive medicine in diabetes. Why choose the subject of diabetes? Let me give you at least 3 good reasons. Firstly, it is estimated that approximately 17 million individuals in the United States alone have diabetes, and it is a growing concern throughout the world. Secondly, it is well known that a significant fraction of those with type 2 diabetes remain undiagnosed. You may want to ask yourself the question, could I be one of those who has the disease and is not aware of it? And the third reason is that diabetes is a condition which in its early stages presents with little or no symptoms, and if left undiagnosed will eventually lead to major complications, disability, and premature death. And remember, we will deal with this subject of diabetes today with emphasis on preventive medicine. Before going any further, let's cover some basic information. What is diabetes? Diabetes is a condition in which there is excessive amount of sugar in the blood. And persistent excessive sugar in the blood adversely affects our blood vessels and finally results in damage of important organs such as the kidneys, the eyes, and the nerves, and so on. Let's now review briefly the physiology, that is, the processes that take place in the body relating to blood sugar. The cells in our body need glucose, which is the simplest form of sugar that is broken down to obtain energy. The body tries to maintain what we call normal range of blood sugar. In a normal healthy individual, soon after a meal, especially one that is rich in carbohydrates, glucose from the diet enters the bloodstream, and as a result, blood sugar levels go up. And in response to the rising levels of glucose in the blood, the pancreas, an important organ in the body, produces a substance called insulin. Now, the most important function for insulin is to lower the blood glucose levels. And it does this in 2 ways. Firstly, the most important one, insulin enters into the cells of the various tissues and helps the cell use up the glucose. And secondly, insulin also triggers the liver to take up the excess glucose in the blood so that it can be stored and later released when there is a need. Now, there are other organs, enzymes, and hormones that play a role in processing and altering the blood glucose levels. But all these factors work together to maintain a normal range of blood sugar in our body. Unfortunately, we live in a world where things do go wrong, and this applies to the way our body functions. It could happen as a result of something we have brought upon ourselves, or sometimes due to factors beyond our control. In type 1 diabetes, the particular cells of the pancreas which produce insulin are damaged or destroyed, and as a result, there is no insulin production. This often happens in the early part of our lives. There are several explanations of how this happens. However, when a significant number of cells in the pancreas that produces the insulin are destroyed, type 1 diabetes occurs. Now let us see what happens in individuals with type 2 diabetes, which is what we are going to be talking about mostly today. We have seen earlier that glucose and insulin from the blood has to get into the cells where the glucose is broken down and used up to obtain energy. Normally, insulin enters into the cells whenever there is a need for glucose to be broken down, but in type 2 diabetes, there is a gradual buildup of some form of resistance, making it difficult for insulin to get into the cells. So we see that individuals prone to type 2 diabetes tend to develop what is known as insulin resistance. When insulin cannot be utilized due to resistance buildup, blood sugar levels remain high. And the pancreas is now constantly stimulated due to the persistently elevated blood sugar levels, and the overstimulated pancreas now produces more and more insulin because it appears that a larger amount of insulin is needed to overcome the resistance. And in the early stages of type 2 diabetes, this seems to work. But as the resistance continues to increase, the pancreas at some point is unable to meet the demands and appears to give up. So we end up with two problems in type 2 diabetes. One, the gradual progressive development of insulin resistance, and two, the gradual decrease in insulin production by the pancreas due to the excessive demands placed on it. The end result is that glucose is not broken down and blood glucose levels begin to rise, leading to type 2 diabetes. The risk of developing this form of diabetes is greater in those with a family history of type 2 diabetes, suggesting a stronger genetic component than in type 1 diabetes. We have looked into what diabetes is and what happens in the body when one has diabetes. Now let us take a little look about how the disease progresses in an individual. From its onset to its termination, either as a cure or disability or even death. Now we call this the study of the natural history of diabetes. Let us see if we can illustrate this with a diagram. The horizontal line that you see on your screen represents a timeline, a period in one's life. And the small vertical line that intersects it represents the point of onset of the disease in that particular individual. Now we have the timeline divided into two. The line before the point of onset represents the diabetes-free stage. That is, there is no diabetes. And the period beyond the point of onset of the disease represents the diabetes stage. Now let us take a closer look at the diabetes stage. You will recall that when we talked about the prevalence of diabetes, we learned that a significant number of those with type 2 diabetes do not know that they have the disease. And this is because, although the disease process has started, they have not developed any symptoms of the disease, and therefore they remain unaware of it. Evidently, in type 2 diabetes, after the onset of the disease process, there is a period of time when the patient is free of symptoms. If the disease process is allowed to proceed unchecked, at some point symptoms will begin to show up. So we now see that the diabetes stage or the disease stage can really be divided again into two stages. One, the early stage, in which the disease process has started, but there are no symptoms. And this period we refer to as the pre-diabetic stage. And then we have the late stage, which is the true diabetic stage. Let us review the natural history of diabetes again. From the natural history of diabetes, we see at least 3 different stages. One could be in the period before the onset of the disease, representing a disease-free or diabetic-free state. Or one could be in the period immediately after the onset of the disease, representing the early stages of diabetes without any symptoms. And this we refer to as the pre-diabetic state. Or we could find ourselves in the latter part of the timeline, namely the diabetic state. If we should extend this line, the timeline, and leave this diabetic state unchecked, it will lead to disability and eventually premature death. So the first step in dealing with the question of diabetes is to know where you stand in the natural history of diabetes. In other words, are you in the diabetes-free state, or are you in the pre-diabetic state, or are you in the diabetic state? I believe that God desires for all of us to be in the diabetes-free state. But how do we find out where we stand in the line of natural history of disease? One way to guess is to see if you have any symptoms. What are some of the symptoms of diabetes? Fatigue, excessive thirst, excessive urination, unexplained weight loss, and sometimes blurred vision. Now, there are 2 problems if you decide to guess and go by symptoms. The first one is that most of these symptoms are non-specific for diabetes. So we really can't go by that. And the second one, which is the more important one, is that most individuals with undiagnosed diabetes remain asymptomatic. So we see a very disturbing picture here. You could be in the diabetes-free state, or in the pre-diabetes state, or in the late diabetes state, and yet have no symptoms at all. So the single best way to find out where we stand in regard to diabetes is to do a blood test and see what the blood sugar levels are. We call this process screening. Screening is a process where we search for unrecognized disease or defect. The term screening is not new to many of us. You may have heard about screening for breast cancer, screening for colon cancer or prostate cancer, and so on. But someone would like to ask, is it really important to be screened for diabetes? The answer is yes. Undiagnosed diabetes is very common. Current estimates suggest that up to 1/3 of adults with diabetes in the United States remain undiagnosed. And it has also been found that up to 50% of those with diabetes were diagnosed after complications of diabetes developed. And here's the most important reason. Screening for diabetes offers the potential to not only diagnose and intervene at an early stage, that is before the complications develop, but also screening offers the possibility of preventing diabetes itself. We next ask the question, who should be screened for type 2 diabetes? We need to remember that by screening, we are looking for people with unrecognized disease. And the term screening is usually applied to a population at risk. So there is no need for everyone to be screened. It is recommended for the population at risk. What do we mean by population at risk? It simply refers to individuals who have risk factors for developing the disease. Now, based on several studies of the many factors that are associated with diabetes, the American Diabetic Association has come up with some guidelines for screening. In other words, they have identified some important risk factors, and based on the presence or the absence of these risk factors, the recommendations are made as to who should be screened. So here's what's recommended. Number one, if you are 45 years of age or more, you should be screened for type 2 diabetes. And if the result is normal, it should be repeated at 3-year intervals. And number two, testing should be considered at a younger age or be carried out more frequently if you are obese or overweight and you have one of the following 6 risk factors that I would shortly mention. What are these 6 risk factors? Number one, if you have a first-degree relative with diabetes. Number two, if you belong to a high-risk ethnic group, example, African American, Pacific Islander, Native American, or an Asian American. And number three, if you have hypertension, that is high blood pressure. And number four, if you have abnormal cholesterol levels, most importantly, low HDL cholesterol or high levels of triglycerides. Number five, if you are habitually physically inactive. And the last one, number 6, and this one pertains to women. If you are a mother of an infant with a birth weight of greater than 9 pounds. So if you have any of these 6 risk factors and you are obese or overweight, your chances of developing diabetes is higher than the normal population, and it is recommended that you be screened as soon as possible and not wait till you are 45 years of age. We have seen that screening is important, and we have also seen as to who should be screened. Now we ask the question, how do we screen for diabetes? Several different tests can be done, but for the purpose of screening, we always choose the simplest test. A morning fasting blood sample is tested for glucose levels. If the value obtained is less than 100 milligrams, it may be considered normal. If on testing we get a value of 126 milligrams or above, it is considered abnormal. And if repeat tests confirms these values, the individual probably has diabetes. What about values between 126 and 100 milligrams? This is considered impaired. So we see 3 groups on screening. The first one, normal, and then we talked about abnormal, and the third one, impaired. Let's review these numbers once again and also see how they correspond to the natural history of diabetes that we talked about earlier. A fasting blood sugar value of less than 100 milligrams would be considered normal. This will correspond to the diabetic-free state of the natural history of diabetes. A value of 126 milligrams or above is considered abnormal, and this would correspond to the disease phase or the diabetic state of the natural history of diabetes. And values between 126 milligrams and 100 milligrams would be considered impaired, and it would correspond to the early stages of the disease phase or the pre-diabetic state in the natural history of diabetes. We now move on to the most important part of our study on preventive medicine in diabetes, and that is intervention or treatment. Intervention will obviously depend upon where you find yourself on the timeline of the natural history of diabetes. Let us say you were screened for diabetes and found the test to be normal, that is less than 100 milligrams. you may now consider yourself in the diabetes-free state. Is there anything that you need to do at this stage? The answer is yes. The interventions at this stage are actions that would enable you to preserve that state of health, that is, being free of diabetes, and also continue with actions that will promote better health. And the way we do this is by following the natural laws of health, eating a well-balanced diet, exercising regularly, by the proper use of water, fresh air, sunshine, and ensuring adequate rest, abstaining from things that we know are harmful to the body, and living a life free of worry and stress by trusting in God. This is how God meant for us to preserve health and promote health. And this is true primary prevention in diabetes, or for that matter, with regard to any disease. But what if on screening you find yourself in the early stage, that is the pre-diabetic state? This is where screening really pays off. In fact, screening is really aimed at picking up this group. In finding someone in the pre-diabetic state by screening, we have actually made an early diagnosis of diabetes. Early diagnosis, along with appropriate treatment, forms the basis for secondary prevention in preventive medicine. So now let's see what is the appropriate treatment for those in the pre-diabetic state. The American Diabetic Association recommends what is called the therapeutic lifestyle changes. And there are 4 recommendations under the therapeutic lifestyle changes. Number 1, carbohydrate counting, because carbohydrates in our diet has the largest influence on glucose. Number 2, calorie restriction. This can be done effectively by cutting down dietary fat. Number 3, weight reduction. Diabetes is closely associated with obesity. We have noticed earlier that obesity is an important risk factor. Special reference is made to central obesity, that is, a waist circumference greater than 40 inches in men and 35 inches for women has been found to correlate with insulin resistance. And the 4th one, exercise. Exercise enhances or facilitates muscle intake of insulin and reduces insulin resistance. A recent study found that 60% of Americans do not engage in any moderate level activity, and that 30% do not exercise at all. So we see that carbohydrate counting, calorie restriction, weight reduction, and exercise form the basis of therapeutic lifestyle changes recommended by the American Diabetic Association. Now let me stress here that these 4 recommendations for the pre-diabetic state is in addition to the interventions we have mentioned for those in the diabetic-free state. That is, along with the therapeutic lifestyle changes, one must follow the natural laws of health as well. Let's move on to the advanced disease stage. What if on screening your results confirm blood sugar levels that are very high? One must initiate aggressive medical treatment as soon as possible. It is important that we do not leave elevated blood sugar levels to go unchecked for long periods of time. Medications are available that lowers insulin resistance, which we have learned is one of the reasons for developing type 2 diabetes. Medications are available that stimulate the pancreas to put out more insulin. We may even have to resort to insulin administration by injections to replace the natural insulin that the body is lacking. Again, let me emphasize that the aggressive medical treatment is to be accompanied by the therapeutic lifestyle changes that we talked about for those in the early disease stage, and we also need to follow the natural laws of health that were mentioned for those in the diabetes-free state. This is where many miss the mark. We must realize that in order for God to bless the treatments that we take, we must first follow the natural laws of health. No matter what approach we take in our treatment, our goal should be to move back from the late stages of diabetes, if you find yourself there, to the pre-diabetic state. We do that by starting on aggressive medical treatment and careful monitoring of blood sugar levels. Self-monitoring of blood sugar has been made simple, and patients are able to do this at their home. Patients on medications are encouraged to check their blood sugars frequently. And when we have brought the numbers to the pre-diabetic state, we should then try to move from there to the disease-free state. And this could be done by following the therapeutic lifestyle changes. Once we obtain the desired level of blood sugar control, we can try and wean ourselves off the aggressive medical treatments and continue with therapeutic lifestyle changes, which is carbohydrates counting, calorie restriction, weight loss, and exercise. And of course, we always need to continue following the natural laws of health to preserve and promote health, which would include a well-balanced diet, adequate rest, proper use of water, fresh air, and sunshine, and attempting to live a life free of stress by trusting in God. So we need to understand 3 steps in dealing with diabetes. First, know where you stand in the natural history of diabetes by screening. Then we make appropriate interventions. When we study and understand the intricate ways in which our body functions and the way our body takes care of its energy requirements using glucose from the diet, and how the body regulates and maintains a normal blood sugar level, we are reminded of the verse in the Bible in the 139th Psalm, "I will praise thee, for I am fearfully and wonderfully made." One of the ways we could praise God is by following the principles of preventive medicine and learning how to take steps to prevent the development of diabetes and the progression of diabetes, or for that matter, any disease, in order for us to preserve and promote health that God has given us. I hope that this presentation has helped you understand a little more clearly as to what diabetes is and how you could prevent it from onset. Thanks for joining me today in our study of preventive medicine in diabetes.
The following program